So I hope I can deliver on that statement. One, thank you again for the invitation. And most of my comments today will do two things. I will describe, for those who aren't familiar with community development block grant funds in the context of disaster recovery, exactly what they are and how they can be used, but also to fast forward into the current recovery context, which is post-Hurricane Sandy. And my colleagues, and certainly those who were presenting before me, have all alluded to the core documents: the Hurricane Sandy Rebuilding Strategy, the National Disaster Recovery Framework. I will make those references as well, but also include more granular examples of how the communities that receive these funds are using them in the context of health outcomes related to their recovery. With that, we'll go right ahead into it, and I'll follow along on the presentation, hopefully and not advance it too oddly. So just by way of background, the Community Development Block Grant Disaster Recovery Funds is not a per se program. When Congress believes that a disaster has risen to the magnitude, one, that there is a presidential declaration, but two, that the resources to address the post-disaster recovery needs far outstrip what any states and local governments have, they have since September 11th, been funding what's known as a supplemental appropriation using the existing Community Development Block Grant Framework. Community Development Block Grants have been around since 1974. They were a consolidation of historic community development programs, things for parks, things for infrastructure, molded together to create an annual entitlement program for states and cities and counties. After September 11th, the attacks on the World Trade Center, Congress decided to use this vehicle, not that the existing federal partners and programs couldn't meet needs, but as the catch-all for all of the community development needs that arose post-disaster. So each of our partners could focus on a segment, but Congress thought, well, with community development dollars, you can hit housing, economic recovery, as well as social services, bricks and mortar, economic development, et cetera. That's how CDBG funds were put into play. Since then, they've been used most notably in Katrina, and then most recently with Hurricane Sandy. To date, and this is the pre-Sandy context in the slide, there are now more than 40 disaster recovery grantees, and the total appropriations, as in all of them combined, now total over $46 billion. Sandy adds an additional $16 billion to that, with some administrative funds going to the agency. Within that context, HUD administers the program by virtue of oversight. As a block grant program, the cities and the counties and the states that are eligible for funds have the discretion to decide how those funds will be used, as long as they are in accordance with the statutory purpose and any regulatory requirements that HUD has. But the decision to fund individual projects is all locally driven. And that's a key separation from many of the other programs. So how do the funds actually get to the ground? How do health impacts touch this dollar or these dollars? We noted that once Congress approves the appropriation, HUD's role is to determine which communities actually receive the funds. Sometimes Congress is very specific, in the case of Katrina, naming the disaster. Sometimes they will just identify all disasters in a certain year. With that, HUD takes a formula, typically a function of the total unmet need when you take into account funds from SBA, as in what's left once SBA funds have been deployed to assist homeowners and businesses, and what's still the unmet remaining need once FEMA funds, public assistance, and individual assistance have been plugged in. So this is, in concept, the last money in. It is not response money. This money, HUD isn't sitting on it. It's never available right after a disaster. Congress has to act. So it's not meant to be used in a response framework. Once HUD determines which communities, based on the formula, looking at, if you will, highest needs, total highest unmet needs to lowest unmet needs, then we start announcing which communities, typically states, but more recently cities and counties, can receive the DR funds. That notification is public. There's both a public announcement in the news as well as the publication of a Federal Register notice, and that's a requirement of the statute.
I'm sorry, so just to make sure that
Sure.
I got this, so I hate to just, so say it again, this is not response money. It has
It's
to
not.
be, it has to, so say it again, it has to, it has to be appropriated by,
It has to be appropriated by Congress, and the sheer timing of it means that the disaster, in the case of Sandy, that happened in October. Congress did not pass the Appropriation Act for Sandy until January. So the CDBG funds, and that's actually one of their fastest appropriations. The CDBG funds aren't there the day the disaster hits. We're not emergency response funds.
so just again, because I want to really listen to the rest of it, but, so the money is in a pot,
Congress's pot.
so it's designated.
No. Only if they find funds available to put into a line item for community development
So
funds.
the 46 billion,
Correct.
is that 46 billion, that exists somewhere?
Correct. Those are awards that have been made since September 11th under various supplemental appropriations to communities.
So and that's being spent now, that's flowing
yes,
out.
all of those funds are being
So
spent
at the end of
now.
the day, all this other thing is that if something goes straight to heck and there's a horrible situation.
Correct.
There is a Congress appropriates the money, and there is a mechanism in place, a bank account to put it in, and that's called y'all.
There is a mechanism.
Okay.
I think they would differ on calling it a bank account,
Okay.
but there is a
There's
mechanism.
a mechanism, and that's what that mechanism is.
Correct.
I'm sorry to interrupt you, but thank you.
No, not a problem. Why HUD, we've noted that it's unlike our partners whose focus is very necessary and strategic. It was the one vehicle that allowed Congress to address a variety of community development needs: housing, social service, economic recovery. There is also the inherent flexibility. Since it's been around since '74, every state in the country, as well as most large cities and counties, currently receive an annual appropriation for community development dollars for day-to-day things, such as funding community centers, fixing roads. They all receive this money, and so most of them are familiar with the strings, quite frankly, that come with the federal funds. We noted it's not an annual program. HUD has to create rules each time Congress decides to have this supplemental appropriation, which impacts the timing of the recovery. Each time we have to do this. It's not a current program with authorization of its own and regulations that match it. So we're piggybacking on existing programmatic regulations. So where does HUD come into this? Once Congress appropriates those funds, HUD announces which states and cities and counties receive those funds. Those communities now have to give to HUD a plan for how they'll use their funds. Proposed plan, what's known as a disaster recovery action plan. It's commonly thought of as an application. They are identifying needs, and then they are matching those needs with community development block grant funds that they will be awarded. There are some communities who do a better job than others, but it is a requirement that they be able to make the link between funding and unmet needs. It's HUD's job to review those action plans and then release the funds based on the needs identified in their action plans. What we don't do, however, is a project-by-project approval. We're not in the business of saying you can fund 42nd Street but not 34th Street. That's not HUD's granular level. We're approving a total plan and strategy for recovery. We also have, of course, a monitoring function. So both HUD field offices as well as my team and HUD headquarters is responsible for both technical assistance but on-site monitoring, reviewing files, going to visit actual impacted areas to determine that indeed every expense that they're claiming against this grant is indeed related to the disaster, meets the statutory purpose, and the strings that go with CDBG dollars. Grantees then have the bulk of the responsibility. In addition to just accepting the funds and receiving them from HUD, there's their level of oversight. Particularly with Hurricane Sandy, Congress expressed concerns with previous performance and laid on several additional responsibilities for grantees. Namely, if you want the funds grantees, you must demonstrate the internal capacity to manage grants. And so you see language in the appropriation statute that speak to financial management proficiency, internal controls, efforts to prevent the duplication of benefits. That is, don't combine FEMA and CDBG and have both funds paying for the same thing twice. They can be used together, but they can't pay for the same thing. In addition, those cities and counties and states are required to provide technical assistance to their subrecipients and grantees. So the nonprofit organizations that they typically work with, they should be walking them through requirements and how those funds should be used. It is the cities and the counties and the states that are also reviewing project proposals. In the cases of states, they are, in most circumstances, receiving applications from counties who are making requests for funds. In the case of Texas, they receive their applications from each of the COGS, the Council of Government Organizations within Texas, who are then making an application on behalf of the counties they're in. Highlighting the action plan process, once HUD receives that action plan, we review it, have determined that the needs are identified and that they can make a connection between those needs and disaster recovery dollars. We can approve that plan and the grantee can begin drawing funds. I will note that there's a public process to that. They have to notify the public of their intent to use funds, at least give the public 7 days for comment. However, with Hurricane Sandy, the second round of funds that HUD just announced back in November, we extended that to 30 days, and it also includes a public hearing. And that is as an effort to increase the level of transparency, but also a recognition that the next round of funding is to be used for a variety of sources or functions, but infrastructure and the sizable amount of investment in infrastructure rose to the occasion enough of putting that additional level of public input in there. So knowing what the process is, what can funds be used for? Almost every congressional appropriation for community development block grant funds, disaster recovery, have stated these purposes: disaster relief, long-term recovery, and restoration of infrastructure, housing, and economic revitalization. This does not preclude these communities, in the context of this audience, from using funds for health outcomes, health facilities. What the cities and counties and states must be able to do is to link them back to any one of these congressional or statutory purposes. And I'll get into a few examples of how communities are doing that right now. As a grantee identifies how they're fitting under one of these purposes, it's key to remember, and often dangerous to assume, that every use they have is related to the disaster. Certainly there were pressing needs in communities pre-disaster, but these funds can only be used for needs that arose as a direct result of the disaster. In this case, we're talking Sandy, but that's the case for each disaster. And that's actually a challenge for some communities, particularly with regard to social service investments, being able to make the link between how the disaster perhaps exacerbated homelessness or exacerbated concerns with air pollutants that affect health. They have to be able to make that link back. It can't just be an ongoing need that existed pre-disaster. In addition, of course, it has to be eligible, and we'll talk about eligible, and meet one of the national objectives. These national objectives include, there's 3, benefiting low and moderate income persons, addressing slums or blight conditions, and addressing an urgent need. Most grantees fall under 2 categories, as in their activities fall under the 2 categories of addressing urgent need or benefiting low and moderate income persons. It is a requirement of the grant that at least 50% of their total allocation be used to benefit low and moderate income persons. Excuse me. What do we mean by recovery? Just the links we were talking about. Being able to connect it back to the disaster. In many cases, these are grantees doing rebuilding of homes. That 100% of our grantees are doing something related to housing. It could also mean reconstructing homes, and it could mean providing loans or grants to businesses who were impacted by the disaster. It could also include new construction. We use the example that if a community had an affordable housing crisis pre-disaster, the disaster didn't make it any better. And in some cases, to address the post-disaster lack of affordability, they're having to build new housing in addition to a strategy that includes rehabbing the existing stock. In other cases, the existing stock was already inadequate and they can't just throw more money at it. They actually have to start from the ground up. The Act mentions restoration of infrastructure. These are your traditional public works projects, roads, sewers. But I will point out it includes the construction or rehabilitation, or what you would call repair, we would call the rehabilitation of healthcare facilities. And in fact, in Hurricane Sandy, we are seeing a significant amount of that. New York City has invested, just on the front end, $183 million of CDBG disaster recovery dollars on the restoration, mobile health services, and some personnel costs associated with Bellevue and Coney Island hospitals. Louisiana used it for what's just had a red ribbon groundbreak or opening of the VA Medical Center, for those familiar with the area, Daughters of Charity. And then they also chose, as a result of the lessons from Katrina, to separate out core hospital functions in a traditional hospital facility, but also to create urgent care centers near or in proximity to other health services so that they're not in the same scenario, which is at least 3 of the parishes without hospitals whatsoever for months, if not years, after Katrina. And then last, I'll focus on economic revitalization as one of the areas where grantees can use disaster recovery dollars. This gets to the very function that businesses were impacted to by a disaster. Perhaps it's loans and grants. It could also include restoring the main streets in the downtowns, while certainly these business owners, et cetera, are also homeowners. Their businesses are what employs the communities and the residents of those areas. And so there's a recognition that an economic revitalization is necessary post-recovery as well. We talked about demonstrating a tie back to the disaster. There are some things you can't do. You can't do things that you can't trace back to the disaster. If Congress has put in any particular stipulations, you certainly can't do those. You can't do activities that won't meet one of the national objectives. The Secretary has waiver authority where there are particular circumstances, but this isn't one of the areas he has typically waived. And that's at the very core of what community development block grant funds are for. The last couple of comments I will make relate to preparedness and mitigation. With Hurricane Sandy and the standing up particularly of the National Disaster Recovery Framework and the publication of the Hurricane Sandy Rebuilding Strategy, there's a recognition that rebuilding can't happen effectively without incorporating some measure of mitigation and, as my colleague noted, building back resiliently or with resilience in mind. With that fact, there were 2 allocations from HUD of disaster recovery dollars to the 6 Sandy communities. And there were certainly more, but the 6 Sandy communities for HUD are New York, New Jersey, New York State, so New York City is the first reference, as well as Connecticut, Rhode Island, and Maryland. By virtue of award, for example, New York City, New York State, and New Jersey each received a little over $3 billion total. $1 billion the first round, another billion and some change the second round. With the second round of funding, there's an emphasis on infrastructure, and with that, there's a requirement that for major investments where the total project cost is at least $50 million, and the amount of CDBG funds is at least $10 million, they have to explain 3 things. Grantees have to explain, 1, identify a specific project, so that's something they normally wouldn't have to do. 2, they have to indicate how they chose to select that project, so going back to the needs, but also how that project is incorporating resilience and, quite frankly, what it's supposed to be able to withstand. So if you're rebuilding a wastewater treatment plant, that grantee will have to state in its action plan how it is that this project is going to be able to withstand the next flood or the impacts of climate change as identified in the President's Climate Action Plan, or whatever other environmental circumstances in the disaster context have arisen as a result of learning lessons. That's a big deal for HUD. It's an area that heretofore you won't see a lot of language in any of our appropriations in this, and you won't see it in our notices, but this round of Sandy specifically focuses on that. And we think, just from a programmatic standpoint, it may be precedent setting. So we're finding out now those requirements for the second round of funding were published in November. The plans that are supposed to have these projects in it are due in March, the third week in March. So we're going to start seeing how those plans incorporate those. The other is that there is a regional coordination working group. So our colleagues from the Corps, EPA, Department of Transportation are all part of a group of federal agencies working with the grantees to identify these projects, to make sure that investments are properly leveraged, and quite frankly, to make sure that they make sense. One of the pieces that's discussed in the Hurricane Sandy rebuilding strategy is this notion of you can't just say this project is being done by New Jersey, particularly if it has to do with water and wastewater, and not think it has some impact on New York City. And so the purpose of the working group is to make sure there's a forum for both the federal agency investment as well as the localities to walk through what are you contemplating? Have you talked to New Jersey? Have you talked to the city? What's at play? The one thing to keep in mind is that grantees with CDBG disaster recovery dollars can't just be looking forward. In that when they incorporate preparedness or mitigation, it can't just be because they're trying to prepare for the next one. They still have to link it back to what occurred. We talked about if the existing CDBG regulations or statute have limitations, the Secretary of HUD does have the ability to waive within the statutory framework those regulations or provisions of statute, with the exception of environmental, Davis-Bacon, anything related to fair housing or civil rights. Quite frankly, it is those very 4 areas that all the grantees would like to see additional flexibility, but Congress did not give him the ability to do that. I'll note as a closing comment and then close with some additional examples. These are resources. I would encourage those who are very interested in not only the federal side of CDBG disaster recovery dollars and resources, but we have links to all of the grantees' action plans on our website, so you don't have to shop every grantee there, so that you can see what they're doing. New Jersey posted their action plan for the second round of CDBG disaster recovery dollars today. So theirs is about to go up on our website as well. It's out for public comment. It has not yet been submitted to HUD for review, but they're going through their 30-day process. I will also note what we're seeing with Sandy in terms of health investments. It's not only the infrastructure, but you'll see, particularly with New York State, this whole notion of protecting healthcare facilities from vulnerability. You may have seen in the news some discussion of their energy resilience plan. So making sure gas stations along key exit paths are actually able to stand up. And if they're receiving CDBG DR dollars, the state is required those gas stations, if they're eligible, to demonstrate what they'll be able to withstand. How do they know they'll be able to stand up with this amount of power loss or during this how many hours of power loss? New York State has taken the same approach, so they're still working out the details for their healthcare facilities. That includes moving generators, looking at alternative sites, It always includes, both for New York State as well as others, the ability for mobile health services. New York City is funding a bit of that now, or did fund, reimbursing that from the effects of Hurricane Sandy. So there are a couple of ways. A traditional way, quite frankly, though, that we don't often see are those first-level health services, the clinics, the smaller, more neighborhood-based activities and projects that get to what I'll call retail health services. You don't often see that in proposals from grantees, and they're certainly eligible, but you don't often see it. And with that, I'll close my comments.
Well, that was just terrific. Thomas Phillips, just to remind you, you're the principal scientist at Healthy Building Research. So now you're oriented to person, place, and time.
Thank you.